Marado, Nale Bavarado, Hangabonar Tumango, Tumanga's all I have to do. Hangabonar Marado, Nale Bavarado, Hangabonar Tumango, Tumanga's all I have to do. Bi bombe, bombe la here marato, o danine be bombe. Imala so mangi saki de se masa paskanam zarde duese, bombe la here marato, o danine be bombe, bombe la he satorako, o danine be bombe. Imala so mangi saki abwade masa paskanam zarde.
Hello, I'm Patricia Amira, and it's a great pleasure once again to welcome you to this session in the WHO NTD Webinar Series. Now, before we begin, a quick reminder on how the session will run. There will be 3 panel sessions, each followed by a brief Q&A session. So to submit a question, kindly use the Slido app. Enter the event code, which is NTD Roadmap. Answer the poll questions that will appear, after which there'll be a prompt to join using the Q&A option on the page. What I would ask is that you keep your question brief and preferably indicate the name of the panel member to whom it's directed. Expecting a healthy discussion, so do make use of this opportunity. There is simultaneous interpretation provided as well in Spanish and French. Move your cursor to the bottom of your Zoom screen, where there is a pop-up bar with both language options. However, panelists must ensure that they have turned off interpretation, as it can cause extreme audio interference. We are using the same social media hashtags as in previous webinars: Beat NTD's NTD Roadmap 2030 and Build Back Better, and kindly tag WHO on your posts. Now, as this session is being live streamed on YouTube, again, kindly refrain from turning this feature on so that we can avoid any glitches. Also remembering to mute your phones and your Zoom microphone when you are not speaking. So with guidelines done, and given that the holiday season is fast approaching, this session will be the last for 2020, having begun back in June. And what a journey it has been. Take a look.
We cannot accept a new normal in which progress against NTDs is put on hold.
We want to make sure that NTDs contribute to WASH, NTD contributes to One Health, NTD contributes to education.
Really allowing the energy, the creativity, and the ideas of young people to be part of the solution.
Water is a human right. Water is linked to the racial justice agenda. It is racist that we don't have water and access to hand washing for everybody on this planet.
So I just want to say we need to continue to innovate.
Mental health conditions and NTDs are highly interdependent.
The skin NTDs require a holistic multisectoral approach in order to address both the physical and psychological impact.
An understanding that we really have to work together, and that increasingly we have to include environmental health.
Participants in the WHO NTD webinars will know it's been a truly collaborative experience. By mobilizing the combined expertise and resources of various stakeholders, can drive and the transformative solutions countries need to accelerate progress towards the goals of the visionary new NTD roadmap. Now, the roadmap advocates for a strengthened integrated strategy. And so today we have the opportunity to get a more in-depth perspective into the increasingly important role that partnerships will play within that, looking at it from different aspects with the 3 panels. Enabling national governments to take the lead in delivering interventions is a key roadmap objective. So let's begin by hearing what our first panel speakers will share with us, especially around their experiences working with health ministries, NGOs, and communities. I'd like to welcome Dr. Martha Saboya, Advisor, Neglected Infectious Diseases Epidemiology, Pan American Health Organization in Washington, D.C. We've also got Paula Brandao, who's the Assistant Professor and in the Department of Nursing and Public Health, Rio de Janeiro State University in Brazil. Dr. Gilbert Bayenda, National Program Officer, Trachoma Elimination in Uganda. We've also got Michael Amede Safopa, who's the Assistant Project Manager, Koika NTD's Control Project, Good Neighbors Cameroon. But before we go straight into the panel, let me first turn to the Director of the Department of Control for Neglected Tropical Diseases at WHO, whom you're all familiar with, Dr. Mala, who, and I'd like to ask this question to you, Dr. Mwele. What does partnership personally mean to you, and how can it help to achieve the targets identified in the new roadmap?
Thank you, Patricia, and it's a great privilege to join this last webinar of the series for this year. So thank you very much, and I thank you very much for your able moderation of every single one of them. Thank you, really appreciate it. And I'd like to reflect a little bit on partnership as we see it today. So I would qualify partnership as a shared responsibility towards achieving identified goals and targets. And when we look at partnership, it's basically, working together to get things done. And this is inherent in the spirit of the new roadmap, where partnerships are central to success. We need good, strong, and more importantly, smart partnerships to deliver on these roadmap targets. And so partnerships have been the fundamental element of NTD programs. And as we can see, the success of the NTD programs in the past roadmap, which ends this year, have mainly been, the success of these programs have mainly been a depiction of the strength of and the boldness of the partnerships. So over the years, we know that NTDs have demonstrated a power of partnership, and in terms of ensuring good implementation. But as we move forward, we need to strengthen the partnerships we have, and we need to also make new ones so that we can achieve the collaborative and country ownership needed to accelerate progress towards 2030. And so just as the diversity of diseases we currently have on our portfolio, we must remember that there are different kinds of partnerships that will be needed to actually ensure that we do address and achieve these roadmap targets. So in my personal career, I've been impressed by the kind of collaboration and informal groupings and partnerships that exist across all the NTD programs. And so as a believer in the power of partnership, I've spent decades promoting this in every aspect, and nowhere is it more visible than in the working together towards getting the roadmap on up and running. And so that has been a true partnership. It has been a true co-ownership, and that's what I believe in. I believe very strongly in that, and I believe that that is the only way we can deliver, because all these programs and targets that we've set ourselves cannot be achieved by a single group, cannot be achieved by a single one disease entity, and it will take all of us working together in a strong, collaborative fashion, working together in a smart way, in an agile way to deliver what we set out to do. And I'd like to end, Patricia, like I ended the first webinar, with a Swahili saying, unity is strength. And unity is strength. I mentioned it at the first webinar. I'd like to say it at the last. It is only through our united efforts that we really will be able to reach the NTD 2030 target. So thank you very much, Patricia.
Thanks so much, Dr. Mwele. If the co-host could please put my video back on. I've not been able to do it. There we are. Thank you very much. Thank you, Dr. Mwele. And of course, as you've just said, different improved kinds of partnerships under different contexts and conditions. Now, moving on to the next speaker, how would you situate the role of regional offices in mobilizing integrated actions to contribute towards 2030 NTD roadmap goals? Dr. Martha, I'd like to pose this question to you.
Thank you, Patricia, for this important question, and happy to be part of this important panel today. WHO regional offices have the unique role of supporting countries to mobilize resources and actions across programs and sectors towards the goals of the NTD roadmap. We have the mandate from the member states to identify innovative ways to join efforts across programs and sectors of government and society to make a better use of resources that countries need to tackle the needs of the communities. The long history and experience each region has on the elimination of diseases need to be leveraged to mobilize institutions and individuals. And I think that this demands an adjustment in the way the WHO regional offices work, because we have been very successful in the implementation of several disease-oriented initiatives. But now, with the NTD roadmap, we should be able to identify the best integrated practices to be expanded. And the NTD regional programs need to be leaders in mobilizing actions across programs to target community needs in their own specific context. And I think that this involves a change from the inside in the way we work. And now it's more relevant to bring partners to support advocacy, research, and implementation of actions toward these common goals of the NTD roadmap. In the case of the Americas, the Pan American Health Organization, that is the regional office of WHO, launched a regional initiative to eliminate more than 30 diseases, because we are convinced that this is the way we can move forward. But as Dr. Malashela said, we cannot do it alone. We need the partners that can consistently contribute in an allied way. So we have funding partners, but also advocacy partners that are interested in joining efforts towards the goals of the PAHOS initiative and the NTD roadmap.
Yeah.
Back to you, Patricia.
Do I have more? Thank you. I was wondering whether I had my sound back. I do. Thank you. Now, PAHO has rallied these partnerships, as you've just been saying, around disease elimination initiative. How is it contributing to align regional and global efforts across diseases?
Yeah, I can speak from the experience of our region. And PAHO launched a regional initiative last year, as I mentioned, to eliminate more than 30 communicable diseases and related conditions. Yes. And it was approved by the member states in 2019. The initiative promotes integrated efforts, intersectoral coordination, community empowerment, and a line of efforts. And it envisions future generations free of the burden of these diseases in the Americas. The initiative relies and promotes cross-cutting principles of gender, equity, human rights, ethnicity, and is completely aligned to the Sustainable Development Goals and now to the NTD roadmap. Besides substantial domestic resources invested by countries, there is complementary funding provided by a diverse group of partners that includes international development agencies, foundations, international development banks, among others. We also have partners interested in advocating for bringing more support to our countries. And this is the case, and this is just an example of the Task Force for Global Health that hosts more than 15 different programs. And they see that in the PAHOS Diseases Elimination Initiative, we have the best way to join efforts towards common goal to impact several diseases, including NTDs. With most of the partners, we have formal agreements to work together, which we think creates appropriateness and commitments to support together countries. And I think that to have successful partnerships to reach the goals of the NTD roadmap, we need to recognize the value of each partner and the power of aligning efforts toward common targets. We need to create a sense of a body that is moving together, taking advantage of the capacities of each one and recognizing what is the support and the contribution of each partner. And although the COVID pandemic has shown us that partnerships are working, now is the time where we need more than ever partners to help countries, not only to overcome the challenges imposed by the pandemic, but to build and rebuild systems that can eliminate diseases through a joint effort between health and many other sectors to tackle the root causes of the NTDs. The role of our regional offices, that is the role of my office in the Americas, is to be focused on elevating the decision-making beyond the ministries of health, involving partners beyond the historical ones investing in the health sector, including bilateral and multilateral agencies, foundations, non-profit organizations, academic, community organizations, among others that are vital to support not only disease-oriented initiatives, but integrated multi-disease efforts.
Wow, beautifully worded and put there about what is needed for the community to come together. Now, you bring a 2-3-pronged perspective here, Paula. Let me bring you in. Now, you are a person affected by leprosy. You're an activist, and from your capacity as an assistant professor in public health, what are the priorities and the practical steps that implementing partners can adopt when working with people affected by NTDs, Paula?
Thank you for the question, Patricia, and thank you for the inviting me to contribute, representing the voice of women and men affected by neglected disease in the world. I am also a woman affected by Hansen's disease, and I think in 5 points deserve to be highlighted. The first point is the organizations must build interventions centered on people and community. Most NTDs have a health disease care process based on biomedical and environmental control, with the historical and social process linked to their development in the background. There is clearly a structural disadvantage fueled by poverty, gender issues, the lack of access to education, health services, paid work, and the consumption of goods and services, which drive the standard economy. The improvement of these conditions contributes to the reduction of social inequalities and the illness due to NTDs. The second point is participation of people affected by NTDs and entities in the planning and evaluation of interventions. The majority of people affected by NTDs belong to a layer of society whose voices are not heard or have low representativeness with planners and decision makers. The representation of people by means of affected people entities makes common problems visible and the articulation between different sectors of society possible for the solution. The third point is recognition and appreciation of the knowledge and practices of those affecting building or adaptation solutions. For affected people and their families, it is important how scientific knowledge is applied in daily life and changes according to local culture, ancestry, the social, economic, and affective structure that surrounds them. It is up to organizations to understand, respect these values, and integrate local knowledge into their projects through a learning system that recognizes and incorporates people's autonomy and self-determination, as well as their knowledge and practices. And fourth, participatory planning, monitoring, and evaluation. These are the biggest challenge. Most of the global guidelines for NTD control programs focus on epidemiological and operational indicators. These indicators reflect very little on the implementation of interventions and do not reflect the interests of those affected. We needed to think about participatory planning and evaluations, including the participation of people, persons, and entities, planning solution, decision-making, monitoring, and evaluation process. And the last but not least, communication and information. Organizations need to be aware of the language used to communicate about interventions during implementation and also in the dissemination of results. The information needs to be accessible, clear, adapted to age and gender, respecting cultural issues, and free of terms or images that encourage stigma and discrimination. Since 2016, I have been a volunteer in the reintegration of people affected by Hansen's disease movement. And we at Mohan believe that a good partnership is made with transparency, recognition of the knowledge of people, and advocacy for life. Thank you, Patricia.
Thank you to add, one of the things I was going to want you to talk about was your relationship or how you have gone around how partnership, is not just with organizers, but with people affected, which allows for more powerful, more meaningful advocacy and in-depth understanding around the delivery of interventions. Is there anything more you'd like to add to that, Paula, experience?
No, I think that's it. Yeah. We needed to thinking about this partnership include the people affected and these entities. It's very important for us.
Yeah. Thank you very much, Paula. Dr. Gilbert, off the back of the just concluded annual global elimination of trachoma meeting, the role of alliances in supporting national goals and ambitions was very much at the center of discussion. What new developments could you share with us around this?
Thank you, Patricia. It's an honor to be here, and greetings from the Pearl of Africa, that is Uganda. Straight out, the partnerships, of course, have greatly strengthened advocacy within the country and within the region, and we appreciate that, especially with delivery of NTD services that traverse, in most cases, the boundaries of a single country. Also, the issue of resource mobilization has been greatly boosted, considering the expertise that we are able to leverage from partners, even across sectors within our own country, as we strive towards elimination of trachoma and other NTDs by 2030. Issues of domestic resource mobilization, issues of supply chain. Good example is the ITI-Pfizer partnership that brings medication for trachoma into the country every year, just in time, which we avail free of charge to the community. We have admired these partnerships, and we have learned from them, and have got some examples that I will share shortly on how we mirror these partnerships at the country level. We are, of course, we've noticed that trust and issues of equity and issues of accountability play a big role in maintaining these partnerships. And after looking at those examples, we did borrow this expertise and this experience and this collaboration to help out with the initial takeoff of the WASH and NTD collaboration across multiple sectors. We did start collaboration with the education sector, the engineers in the water and environment sector, the WASH NGOs. And when you point to these examples of successful partnerships and also their own experiences of delivering services through partnerships, then we got this going pretty quickly. We also got the cross-border implementation of MDAs with Kenya, and we're trying to push this with our neighbor South Sudan. And also surgeries. If we're going to do surgeries, TT surgeries, we do go through partnerships. And I'd like to point out that we did have a partner whose main goal initially was surgeries, but through this collaboration, we got them helping out with MDAs across borders. So partnerships definitely have worked for us in terms of program delivery, in terms of collaboration with our neighbors, and in terms of being able to deliver commodities, diagnostics to our people, even in the hardest to reach communities. The great saying of leave nobody behind, definitely partnerships have come in to show that this is the way to go.
Thanks so much there, Gilbert. Michael, let's turn to you. Tell us, how have you collaborated with partners at national level to support NTD programs? And of course, what lessons can you share from that?
Pour cette participation à ce webinaire qui est très important. Ici, dans le cadre de l'implémentation du programme national de lutte contre les helminthiases et la schistosomiase, je tiens déjà à rappeler que l'implémentation au niveau national regroupe beaucoup d'acteurs à tous les niveaux. Et ce que nous pouvons faire déjà dans le cadre du projet COICA, c'est que dès le départ, le partenariat avec les autres partenaires a commencé dès la phase de conception du projet. Donc, dès la phase de conception du projet, il y a eu plusieurs échanges qui ont été faits avec le ministère de la Santé publique, avec le ministère de la Santé publique à travers la coordination nationale de lutte contre les MTN, avec la coordination nationale de lutte contre la schistosomiase et les helminthiases intestinales, ainsi que les délégations régionales de santé publique. À travers et le système national Unis tels que l'OMS, avec lequel nous avons travaillé, ainsi que l'UNICEF pour la mise en place des activités WASH. Aussi les autres partenaires tels que Sightsavers et Helen Keller qui travaillaient dans ce domaine. L'implication de ces partenaires dans la phase de conception du projet nous a permis d'orienter le projet initial vers les défis actuels du pays et d'adopter une stratégie pouvant mener à l'élimination de la schistosomiase et des vers intestinaux dans la région du centre. Aussi, un groupe de travail ministériel pour la coordination du projet a été mis en place au niveau du ministère de la Santé publique qui appelait aussi les autres intervenants du ministère de l'eau et de l'énergie en ce qui concerne les activités WASH et aussi le ministère de l'Agriculture, le ministère de l'Éducation de base et de l'enseignement secondaire. Dans la mise en œuvre particulièrement, prenons un exemple sur la partie communication. Des équipes ont été mises en place, des équipes tenant compte prenant des acteurs du secteur de l'éducation, du secteur de l'eau, l'hygiène et l'assainissement, du secteur de la communication, dans les points focaux de la communication. On a mis en place une équipe pour pouvoir pré-tester d'abord tous les outils, développer les outils de communication que nous allons utiliser sur le terrain dans le cadre des activités, ainsi les pré-tester et aussi les tendre dans d'autres régions du Cameroun. De même, les journalistes, les différents acteurs des médias ont été formés dans le cadre des activités de déparasitage, de distribution de masse de médicaments, et ainsi que les activités de lutte contre les maladies suscitées, ou bien avant chaque déparasitage. Voilà. De même, lors des distributions de masse, nous avons essayé de mettre en place une plateforme qui regroupe les acteurs de la santé, le district de santé, les acteurs de l'éducation, les différents secteurs apparentés et les communes d'arrondissement, les mairies. Donc, dès les formations pour les différentes distributions de masse, on essaie de les former tous ensemble pour que déjà se crée cette plateforme-là qui va après, au niveau du terrain, être opérationnelle pour les distributions de masse. Et la chance que nous avons avec ces différentes plateformes-là, c'est qu'elles nous permettent de peaufiner notre stratégie, d'adapter la stratégie en fonction des réalités de chaque domaine, de chaque contexte. Et la contribution de chaque membre, de chaque acteur, de chaque secteur nous permet vraiment d'atteindre l'objectif que nous visons pour le déparasitage. Dans le cadre des activités WASH, la stratégie WASH a été élaborée en collaboration avec le ministère de l'eau et de l'énergie et le ministère de la Santé publique, les différents communicateurs et l'UNICEF aussi, qui nous a donné beaucoup d'éléments très importants pour pouvoir mettre en place une bonne stratégie pour la construction des points d'eau dans les écoles, ainsi que la mise en place des clubs WASH, des comités WASH dans les communautés. Donc, et en ce qui concerne les autres activités de contrôle vectoriel telles que l'épandage des molluscides pour la prévention et la réduction de vecteurs pour la schistosomiase, nous avons aussi mis en place une plateforme travaillant avec le ministère de l'Agriculture et le ministère de l'Environnement, qui sont aussi là d'autres partenaires qui nous ont beaucoup aidés à gérer cela. Sans oublier l'OMS qui a été très importante, qui, ici, dans le cadre de cette activité de lutte antivectorielle, nous aide beaucoup dans l'approvisionnement des molluscides et aussi dans les stratégies, dans la mise en place du processus d'homologation.
Go ahead, sorry, just finish that point off. Yeah, I mean, really, as many ways as you can think of to collaborate. You have been doing some incredible work there in Cameroon. I'm sorry, I'm just very conscious of time and the amount of questions that are also coming in for the panelists, which I would like to pose to you. Let's start off with you, Martha. How do we share lessons from the Paho region with colleagues in other regions? Are there examples of WHO connect regional experiences?
Let me turn off that interpretation. Thank you, Patricia.
Turn off interpretation. Thank you.
Yes, I already did it, I guess. I hope you are listening.
Yeah.
Well, okay.
I can hear you loud and clear. Yeah.
Yes, PAHO participates, of course, in several forums of WHO, and every time we try to share the experiences in not only in the region but in our countries. And based on that experiences, for example, WHO is now working on a similar initiative to eliminate multiple communicable diseases, not only NTDs. And that is based on the example of PAHO. But of course, we are more than interested in working with many other partners to share the experiences in our region and to learn from other regions, of course, and in that way, join efforts to reach the common goals. Back to you, Patricia.
Okay. So thank you. A question for you, Paola. What must implementing partners do to break down the barriers between implementing partners and affected communities to enable the voices of affected people to come to the front?
And I think, Patricia, we need the first thing is give the voice of the man and the woman, because we need to work with the other organizations, and we need to have the spaces to do this. Example, in this COVID-19 pandemic, we work with the virtual platforms, and this facilitates to the people affected any disease to connect in the life. But we know many people don't have internet access, and many people don't have money to pay this technology. And we need to facilitate this information in this local, in places.
That's right. So right. Dr. Mwele, a question for you. What are your thoughts on how partnerships need to respond to the uncertainties of the future, for example, climate change, which the roadmap states needs additional action? Dr. Mwele.
Right. Thank you very much, Patricia. Thank you for the question. I think the most one of the most important things is, as you rightly said, or as the question rightly said, is that being prepared. And I think climate change is a key factor which will really affect NTD programs as we move forward, particularly those vector-borne NTD programs. And we're already starting to see that. And I think this is where my idea of talking about new partnerships. So working with the current partnerships that we have to focus more on some of these issues which are really going to be important just around the corner, as they're starting to be important now, but bringing, getting our current partnerships to focus on these issues, because the guidance is already there in the roadmap. It's about really, as partners, taking together what we have and moving forward. And I think also adding new partners to this equation and new groups of people who can actually, that's why I keep saying smart partnerships. It's really not just about partnering, but being smart about it. And so we do have people that are not part of the current partnership that can help us in the area addressing issues around climate change. And I think, we have to work better with the environmental groups, UNEP, the environmental community, and all the others in trying to move this forward. So yeah, thanks.
It was very much from our conversation last week as well, Dr. Mwele. Thank you for that, for bringing that up again. Gilbert, a question for you. What do you think partners from the global north should be doing to elevate the work and voices of governments and civil society in endemic countries?
Thank you, Patricia. Very good question. Quite a bit, and I have to say they have been doing quite a bit of work. I'm looking at probably strengthening the idea of partnerships. That's where I would really start, because you do realize that as we advocate for partnerships, there are still some barriers to integration and to partnerships. These would be very well explained, considering that those from the global north do have a pretty good relationship with most of the stakeholders and the implementers, as well as the I would say, donors that we're working with. Secondly, I would think that the area of R&D or publication or getting the information out there is an area that we probably would benefit quite a bit, and the help from the Global North would be vital in this endeavor.
There's a commitment to driving NTD activities at country and grassroots level. With that said, here is to the passionate community health workers around the globe who, like Edouard, who you're just about to meet, are literally doing the legwork of people affected by NTDs. Have a look.
Le jour du lancement, les premiers jours et le ravitaillement, je suis obligé de couvrir les 15 villages. Et quand on réunit les 15 villages, c'est vraiment des kilomètres et des kilomètres. J'aime mon activité avec passion parce que vraiment depuis l'enfance, la santé m'a toujours plu. Ce qui fait que remplir ces tâches quotidiennement, ça ne me gêne pas. Ça fait un plaisir de rendre service à la communauté.
Absolutely brilliant. So what is the role of partnerships for the future of NTD research and development of new medicines, diagnostics, and tools for control and so on? It's all about intensive cutting. Saw in the short video, which is our people and community centered. And also, of course, as Paolo has been saying to us earlier on in the first panel, now we've got just under 20 minutes to unpack this in a way that can shed light on how technical progress is supported and sustained. So joining us, Mwasi, who's the Executive Director for the African Research Network for Neglected Tropical Diseases in Kumasi, Ghana. We also have Dr. Adriano Kasuli, who's the Director, WHO Collaborating Center for Echinococosis in the Istituto Superiore di Sanità in Rome, Italy. Dr. Frederick Schmidt, Senior Global Project Lead at the Bayer Crop Science in Monheim am Rhein in Germany, and Dr. Isaac Chikwana, Senior Director, Investment Strategy, Access and Delivery at the Global Health Innovative Technology Fund in Tokyo, Japan. And last but not least, Dr. Anouk Gouvras, Communications and Program Manager at the Global Schistosomiasis Alliance in London in the UK. Let's start off with you, John. It's just absolutely wonderful that, you know, research and development on the African continent is strengthened with partnerships such as the ARNTD, which is a model of success, not just for capacity building, but also for women in sciences. And I had to mention that, of course. But what would be good to hear at this point is what lessons have been learned, and can these lessons be replicated in other parts of the world?
No, thank you very much for that, Patricia. And I'd like to just start by congratulating the WHO and Dr. Mwele for the successful, overwhelming endorsement of the new roadmap 2021 to 2030 just last couple of weeks ago, last 2 weeks. The reason why I say this, it's really important for us to have this solid foundation of a consensus on what we want to do, how we want to do it, and when we want to achieve. And really the foundation is at the heart of it all, and it's worth celebrating. Now, beyond the celebration is really the walking of the talk, and for this you need all hands on deck. You know, a major drawback of the efforts at implementing NTD elimination eradication plans has been the weak partnerships that we have, and perhaps more than ever in these COVID days where travel has been severely curtailed, we do see the acute need for in-country capacity for not only implementation of NTD control and elimination programs, but also the capacity to do needs or gaps assessments, to do monitoring, to do evaluation, and most importantly, to formulate transformative policy and implementation. Now, in NTDs, we're often talking about the neglected people, and this is right, those who are suffering from the disease. But I also think there's this group of what we call the neglected researchers. These are the people who are most proximal to the issues, whose voices are often muted or marginalized simply because they do not have the platform needed to have their voices heard. We know that NTDs are described as a complex, a constellation of diseases, which are very complicated because at the heart of success in achieving the roadmap will be really an understanding of that complex interface between the persons, the diseases as they are, and the environments within which the people find themselves. And for this, you need all kinds of professionals, including the social anthropologists. And for a discipline like this, for example, you certainly need people who understand deeply enough and have the capacity to extricate that critically needed knowledge to inform the design and implementation of interventions. And this is where the ARNTD is a good example of partnership. We have partnered with a large number of NTD actors in country, and also a lot of the global NTD actors like the USAID and the now FCDO UK Aid. And most specifically, what we have done in recent time is to provide a platform or opportunity for Africa-focused NTD researchers, including women NTD researchers, as you rightly mentioned, to be able to bring the ideas to the fore and to have an opportunity to conduct research, particularly implementation research, which would inform their programs directly regarding what to focus on and how to go about rolling out some of these interventions. Now, this funding has been so critical. It's changed the profiles of many of these researchers who hitherto would not have the opportunity to apply for some of these big grants with very stringent, or shall I say, difficult to meet conditions. And with the ARNTD being so proximal to the issues as an Africa-focused, Africa-based network of NTD researchers, we've been able to partner with the USAID FCDO, with of course the insights and support from the WHO and others to provide this platform to researchers. We have already seen how some of the work that has been done has been able to be scaled up, and some of these awardees have been able to receive much larger grants, have published very important papers that have informed to some degree some of the actions that have been recommended in the roadmap. And we're so pleased actually about the involvement of women in this, some of whom this is really their first grants, their big break. And many have testified as to how this has really changed their lives. Just a couple of weeks ago, we had a very interesting webinar. We had some of our awardees.
I think we've just lost him there.
I don't know if I'm back now, but
oh no, there we are. There you are, John. I can hear you now, John. Go ahead.
Let me just round up. I'm just talking about awardees, female awardees from Benin, and then another from Kenya, who last couple of weeks to present really exciting work that they had done in their countries, and how this was actually informing the rollout of some of the elimination programs in their country. So that, for me, is a classic example of partnership with people who are proximal to the ground, working with people who have the funds and have some extra technical know-how to really deliver very proximal to where the issues are. And this is what should be pursued and replicated.
Thank you. You said so much there in terms of advice for other countries as well who are affected by NTDs. John, thank you. Dr. Adriano, you established a partnership to investigate echinococosis, a very neglected tropical disease caused by tapeworms in the European region, thinking about Brexit. I don't know what's going on in my head. What are some of the key lessons that you've learned from this partnership?
Thank you, Patricia, and wherever you are, good afternoon to everyone from Rome. So, lessons. First, I learned that the burden of some NTDs, such as cystic and alveolar echinococcosis, extends beyond tropical and subtropical regions to include worldwide pastoral and rural communities where the life cycle of the parasite is established, even of medium-high income countries, including Europe. So even in rural Europe, NTDs affect marginalized and rural communities, often distant from the healthcare settings. This is a case of cystic echinococcosis, where underreporting, misreporting of patients receiving medical attention are among the factors that contribute to neglect of these parasitic infections. In this context, ultrasound surveys, ultrasound is the gold standard to detect abdominal CE, cystic echinococcosis. So ultrasound surveys is a rapid impact package on rural communities to access to a health service that would have otherwise been not offered to population in need. And this is really contributing to universal health coverage. So thanks to an international and interdisciplinary partnership funded by the European Commission, we conducted the biggest population-based ultrasound surveys research base. Wow. We are dealing with a cross-sectional study by ultrasound. We screened 25,000 people from rural areas of Romania, Bulgaria, and Turkey. So doing that, we basically have brought to the light the real burden of cystic echinococcosis in this area. We estimate more than 150,000 people that may be affected in rural areas of Romania, Bulgaria, and Turkey. 45,000 only in the European Union, so Romania and Bulgaria. And this is a breakthrough in the current epidemiological scenario. So last, this contributes to better define health agendas in the concerned countries and more broadly up to a global level.
And so how can partnerships facilitate your platform of collaboration to meet the 2030 roadmap goals?
I should absolutely stress that partnership is a pillar in modern science. In fact, collaborative partnership is in research as a broad and tremendous catalytic effect on working together. So merging diverse expertise and increasing the output of the research or the project. So multidisciplinary and multi-center approach is especially necessary for entities such as cystic echinococcosis, as resources may be limited. So working together may help to make a difference and to reach a critical mass and produce solid data, evidence-based data for the control of this NTD. And in this context, WHO collaborating centers can really facilitate partnerships and have a privileged position to do so. As a WHO collaborating center, we coordinate international research projects. We support international European agencies such as the ECDC or the EFSA, the European Food Safety Authority, to harmonize data on collection of data from member states, monitoring and reporting of CE. So with the aim of improving surveillance and also the control of this infection, this parasitic infection, we encourage governments and international agencies to lobby the European Commission to champion new health policies for the notification of human and animal CE. Basically, we, let me say, promote health equity, providing to the partnership common background, tools, access to biological and medical knowledge for the centers which are involved in this network.
Thank you. Thank you so much there, Adriano. So working with partners, pooling knowledge, expertise, tools. I just want to turn to you now, Frederick. What have you achieved as part of the Intervention for Dengue Epidemiology, also called IDEM program in Malaysia, that began early this year? Sorry, did you hear me there, Frederick? Can you unmute? I just wanted to know whether you can hear me. I can't hear you, Frederick. Ashok, can you hear me?
Yes, I can.
Oh, you can. Okay, so is the
I think his
problem
mic
coming from Fred? Could you switch your? Could you unmute yourself?
Yes, I am.
There you are. There you are. Now
I'm
we
sorry,
can
there
hear
was
you.
a
Yes.
double mute stuff. My apologies.
Okay, not a problem. Did you hear the question, and should I repeat it for you?
No, I got the question, Patricia. Thank you very much.
Okay.
And I
All
will.
right. Go ahead.
Well, we'll just say that basically regarding these IDEM projects that we are running in Malaysia, which is an intervention against dengue in Malaysia, the partnership make it allowed to make it happen. Because as a single entity, and here I speak with my company voice, but as a single entity, you cannot run such kind of program. It's a fairly large program which covers many localities across Kuala Lumpur, covers nearly or more than 900,000 people. So that's really huge. And to perform such kind of research, you need to do partnership. And basically in that program, we have integration of different interventions. We have some technical interventions with targeted odor residual sprays and auto dissemination device. We have the need for community engagement, which is a key pillar of the project. And of course, we also have the need to have the information on the disease that is happening in the country. And therefore, we crystallized the creation of a consortium. And in that consortium, you have industrial partners like Bayer and also a small startup company called Into-Care from the Netherlands. We also put together, we enrolled as well academics in the projects, and we have the support from the London School of Hygiene and Tropical Medicine, the Cedar Hospital from Lyon, and the University Claude Bernard from Lyon. And they are bringing their wealth of knowledge in epidemiology and biostatistics, which are needed for this kind of large project. And we also have the support of non-profit partnership. We have IVCC, Innovative Vector Control Consortium, joining the project, which is bringing stakeholder engagement and funding. We have the Institute of Medical Research, which is basically leading the operations on the ground, the entomology, and also bringing human resources. And we also have the Ministry of Health for Malaysia, which is giving support to the project, also bringing some funding and also bringing some advice and giving access to
good
system in place, the e-dengue, which is recording, I would say, the evolution of the disease on the ground.
Okay.
So really, partnership is key to be able to run such kind of projects.
Yeah. And do you plan to expand this strong prevention to achieve the 2030 roadmap targets?
Yes, of course. I mean, this project that we are doing at the moment is targeting dengue diseases, and to fight vector control with dengue disease, you fight the Aedes mosquitoes, which are present throughout the world, and half of the population of the world is at risk from getting those diseases. So of course, we would like to integrate the learnings that we have in that project and bring them into other areas of the world, other countries, and also other regions like Latin America. And this will probably strengthen one of the pillars of the NTD roadmap, which is getting more country engagement and country leadership in running such kind of programs. So getting the learnings and bringing them to some other areas to support the elimination of disease and see how this integrates into a larger program against disease control.
Thank you very much, Frederick. Isaac, let's tap into your knowledge coming from an international public-private partnership organization, the world's first in global health R&D. What do you think should change in the current global partnerships to stimulate innovation in NTDs?
Thank you very much, Patricia. Let me just, if you allow me to echo something that Dr. John Mwasi said, in congratulating Dr. Mwele and the NTD department in the guidance in developing the NTD roadmap. I think there needs to be a shift, and dare I say, paradigm shift in the supply and procurement and delivery of the NTD products, be the diagnostics, medicines or vaccines. Because at the moment we rely heavily on donations, and I don't argue that donations will play a role, but I think we need to move towards more sustainable procurement and supply systems. Now, the donations we're talking about here, they're addressing a couple of diseases and a few medicines. Imagine we have 20 diseases, and then if we have products for all those things, obviously donations are not going to cut it by themselves. So we need a more sustainable system. And I think this is something, I hope this is something that the sustainability framework that the NTD department is working on will address, and GHIT will be very happy to be part of this, because we don't see it just as addressing supply issues, but it's also an incentive to innovators and product developers to bring their products onto the market or into the R&D pipeline, so to speak, if they see that there is an outlet at the end for their products.
Of course, yeah. And how is the GHIT positioning itself to support the new roadmap targets for 2030? Let's hear some specifics here.
So as has already been mentioned, it's all hands on deck, and for GHIT, we are on deck already. Since the beginning of GHIT, we have been focusing. GHIT funds the research and development of health technologies for TB, malaria, and NTDs. And for NTDs, since the beginning, we had sort of focused on just a small portion of the 20, but recently we expanded that to cover all the 20 NTDs. So hopefully we'll see more innovations coming into the pipeline. And up to now, just over 30% of our products, of our projects have been on NTDs. We hope to see more of this. But the good news is that out of that 30%, 2 of them are actually quite advanced, and we hope to see them. We hope to see them on the ground in a couple of years. And one of them is pediatric praziquantel, which is being developed by the Pediatric Praziquantel Consortium. Another one is innovative treatment for mycetoma. So hopefully in 2 to 3 years, this will be on the ground, and we will have 8 years to contribute to the roadmap by 2030. And beyond.
Yeah. Great. Thank you. And beyond, yes. Thank you very much. Dr. Anouk Gouvras, the new roadmap advocates for more cross-disciplinary and operational research. What are the prospects or options partners have to stimulate such initiatives?
Thank you, Patricia. And just to say many thanks to the WHO for inviting the Global Schistosomiasis Alliance, who I am representing, to participate in this important panel. It's really wonderful to see this focus on partnerships and research. And I've been watching the WHO webinars, and it is clear that partnerships and cross-disciplinary work has been one of the main threads throughout the webinars, and is a real key pillar of the new roadmap. In fact, the very way the roadmap was developed, using this open consultative approach where, we all were invited to feed into the process, is a great example of working together, and very much appreciated by the Alliance. Whilst, we at the GSA, we are schisto obsessed. We know, but we do understand that diseases do not occur in a vacuum. And more importantly, we know that the underlying factors that lead to disease risk and transmission in a community are multifaceted and require cross-sectoral and multidisciplinary approaches from research to implementation. The GSA platform brings together experts from different disciplines to tackle challenging and often complex issues. Our platform is being used by researchers and practitioners from public health programs, from diagnostics, epidemiology, social sciences, engineering, genomics, vector management, and health industries to share best practices, identify gaps, and address common barriers for transformative research and innovation and implementation. I mean, to give an example, a particular challenge for schistosomiasis is the highly focal nature of its distribution, which can lead to, you know, over or under treatment of communities. This is linked to the methods used for mapping, monitoring, and evaluation of by schisto programs, and the consequences to people and programs, you know, include the persistence of morbidity in undertreated communities, the risk of treatment refusal in overtreated communities, the inefficient use of precious resources, whether they are, you know, financial, labor related, or you know, the treatment tablets themselves, and of course the difficulty of measuring program impact. So by bringing together researchers from different disciplines, program managers and donors, this has led to a greater understanding of what the challenges are that programs face, and of the evidence gap that need to be addressed, and the research needed to develop innovative and practical solutions. And there's now been a concerted effort by all partners and stakeholders to look at how changes could be made to survey design, diagnostic use, data collection and analysis, and to assess how these can feed into programmatic decisions for schistosomiasis elimination. The needed research and tools are being developed, and we of course need to test them out, see what works, see what doesn't in different settings. You know, and research and development and operational research do come at a financial cost, but funding this collaborative research and testing out these tools, you know, we will become more efficient in reaching those communities that really need treatment, and we will demonstrate the impact and identify where to ramp up efforts to accelerate disease elimination and interruption of transmission. Thank you.
Thank you so much. We're well into a Q&A time here, so let me start firing away with some of the questions I have here. Dr. Kasuli, how is the WHO Collaborating Center now assessing, reassessing research priorities to meet the new NTD roadmap and beyond? And are there changes in priorities or timelines or identified needs for different types of partnerships to facilitate this? Adriano, that was for you.
Yes. So all the current WHO collaborating centers on echinococcosis are consultants providing advice for the roadmap. So basically the roadmap on NTDs regarding echinococcosis relies on an increasing number of countries implementing control programs. This is the target.
Wow, okay. John, let's get you back here. What is the stepwise approach to establish a successful partnership in NTD research and intervention? And how can one get access to these promising partnerships in African and Southern nations?
No, I think, no, thanks for that. And I think the first thing to really do is to identify a reliable partner, a legitimate partner for that matter. And so we have, for example, the ARNTD, which is a network of researchers from across the continent, not only who live in the continent, but who have their research embedded in the continent. This is not just biomedical researchers, but you've got the social scientists, you've got even the policymakers and others all being part of this network. We also have a cadre of young or upcoming researchers, because we do realize that sometimes the senior researchers do not have the time for some of the smaller things that we really need to do to get deep in there. And so you have this opportunity to set up where you have the younger, more nimble, eager researchers who will be supervised by the senior, more experienced people to answer questions that may be small, but very critical, which the seniors may not be able to answer. So being able to have this tiered approach towards partnership is critical. I know we're out of time, so I can't really give you the full spectrum of what I wanted to talk about, but basically just being able to identify a partner who understands the space and who also has the capacity in terms of the access to those on the ground to be able to provide that knowledge, which will inform the design and implementation is most critical in a partnership.
Okay, Okay. Anouk, what is the scope for GSA in forming other partnerships on other NTDs?
That's actually a really good question. Again, you know, we're focused on Schisto, but when you're looking at the environment and ecosystem that Schisto occurs in, it shares it with a lot of other NTDs. So when you're looking at particularly things like WASH, you know, water, sanitation and hygiene, I mean, that covers quite a difference of a variety of NTDs, and working together through partnerships with the WASH sector means that you can tackle more than one NTD, which is really important. And there have been great strides made with collaborative work for WASH and NTDs. And there's stuff going on in Ethiopia, Uganda, Kenya. And, you know, it's really important to look at where the opportunities are, where we can put things in place that tackles more than one NTD. And the GSA is always interested in partnerships for this sort of work.
Great. Isaac, I'm just going to squeeze one more question in before we can go to the session. Isaac, how do we better connect advocacy across PDP, operational research and treatment programs to target policies at national and donor level to support the roadmap?
Thank you for that question, Patricia. So we at G8, we're actually working on a platform that could actually be one of the solutions to this. Together with the government of Japan and UNDP-led ADP, we have a platform called Uniting Efforts for Innovation and Access. So we basically bring together everybody across the whole access value chain, from innovators, product developers, funders, government, and other implementing partners. And we sit down in one room and we discuss the challenges we're facing, and we try to propose solutions. And I think from there, then we can develop, you know, different, very specific partnerships. But I think we all need to be in the same room, because I've attended a lot of sessions where we're basically talking about the same thing, but in different sessions. So I think we really need to get together and really focus on the issues, and then we can have more specific solutions. I think so. The key is really to be in the same room.
Okay.
So
excellent perspectives there from our pharma research and academic. Again, it's all about pooling knowledge and tools and making it count where it's most needed. So thank you to all the panelists. Let's take a short visual break to Rwanda.
Before 2007 in Rwanda, there was no program against neglect tropical diseases, no data about these diseases. The situation really was not known. By the start of 2008, and with the infant support, the mapping of some neglect tropical diseases was conducted in Rwanda. NFund is supporting in the mass drug administration, NTD surveillance, specifically on schistosomiasis and social-transmitted ehrlichiasis. And with the support of NFund, our children are dewormed on a regular basis.
Yes, so overcoming challenges by changing culture and operating models with donor and partner support. So coming full circle, as it were, let us now have a conversation about a point Dr. Mwene brought up right at the beginning about the diversity of NTD partnerships and how each can mobilize action across the various programs, research and advocacy for scaling proven innovations, a conversation which I hope lively and engaging for the next 15 to 20 minutes. So joining us for this is, Dr. Mona Hamami, the chairperson of Uniting to Combat NTDs and the Crown, and also the senior director of the Crown Prince Court of Abu Dhabi in Bahrain. We've got Dr. Greg Perry, the assistant director, General at the International Federation of Pharmaceutical Manufacturers and Associations in Geneva, Dr. Kisito Ogusang, Chairperson of the Neglected Tropical Diseases NGO Network, Ms. Sylvia Santos, the Head of International Cooperation and Advocacy at ANESFAD Bilbao in Spain, and Priyanka Kadan, the President of the Snakebite Healing and Education Society in Mumbai, India. Also on video, we have the Honorable Dr. E. Osagie Ehanire, who is the Minister of Health in the Republic of Nigeria. And as we know, it's always helpful to have as much in-country perspective as possible. And so with the great progress being made against NTDs in Nigeria, we had an opportunity to ask the Honorable Minister of Health a couple of questions earlier about how Nigeria is preparing to sustain the gains through the new NTD roadmap that is strongly supported for adoption at the recent World Health Assembly.
Nigeria is developing its primary healthcare network. We are building one primary healthcare center in every political ward, which will give us 8,655 primary healthcare centers, which are the platforms on which we want to integrate a whole row of programs, including the NTDs. We are going to have to train the human resource for health with a lot of connectivity. We are going to be working on task shifting and task sharing to ensure that we take also persons from localities and train them as either community health extension workers or nurses or doctors, whichever will be deployed at the primary healthcare center, so that the entire program of NTDs can be domesticated within a primary healthcare center that is not far from communities, so that the distance between the facility where service is rendered and those who need the service is reduced tremendously. We do not expect that anyone will be further than 5 kilometers away at the very maximum from a primary healthcare center, which will give us the advantage of proximity in reaching out to the those who need this service. There is also the question of domestic resource mobilization, which is going on. The department is reaching out to get support, apart from a budgetary allocation, also to get support from private sources that will ensure that the program is kept on the front burner.
Now, we also posed the question around the elimination of NTDs in Nigeria, which is strongly supported by many partners, and whether this helps Nigeria to prepare itself to really take ownership of these programs. This was his response.
Well, yes, a lot of the support we are getting, as a matter of fact, very indigenous support. There is a T.Y. Dajuba Foundation, for example, that is very active in the fight against river blindness, and other foundations that put money in here. So the preparation goes along with the experts we have. We have a lot of public health experts who have worked in these areas and have acquired the experience by working with WHO or other organizations who have deployed them in areas and in endemic areas and have come home with necessary knowledge and experience. So with these human resources and the assets that we have on the ground, and then the financing that we will be working on the augmenting, we hope we can get ownership of it, as well as ownership of actually other disease programs which will be able to be domiciled in the primary healthcare center, which we are building, and the possibility of being able to refresh knowledge, learn new skills through telemedicine, and through being able to have support of doctors through mobile service is all part of the strategy that we are working on here.
Great, great. Thanking the Honorable Minister of Health in Nigeria for taking time to share with us some of the practical structures and integrated strategies in play to really domesticate NTDs within the Nigerian healthcare system. Moving to Dr. Mona Hamami now. Now, UTC has demonstrated it can bring robust advocacy to the highest political levels. What more can countries do to support the delivery of the NTD roadmap?
Thank you so much, Patricia, and thank you so much for the WHO for having us. And I want to also say that I'm very honored to be with this panel that is fed esteemed speakers. I mean, I think countries have been extremely instrumental so far to all the achievements that we've seen, and that's very evident from things that we've seen on the roadmap, but also their commitment to SDGs. I think also the overwhelming support that we've seen for the endorsement of the roadmap during the WHA shows that. Now, the new roadmap is sort of a vision for those countries, right, in the next decade. And country ownership would be instrumental. In fact, I would argue without this country ownership, there is no way that the roadmap would be implemented.
Exactly.
However, I would posit maybe 5 things that I think are important. So one is making sure that NTD interventions are integrated into national development plans, that NTD interventions are incorporated as part of universal healthcare packages as an instrumental part, an essential part, that countries report progress on NTDs as part of their SDG reporting, that countries start thinking about allocating domestic resources for NTDs and in a very explicit budget plan. And lastly, I would say that heads of states and leadership beyond ministries of health take on this leadership of this platform to champion NTDs. Now, country leadership is a core part of the new strategy of UTC. And one way that we're approaching it is that making sure that NTD is integrated into sort of those global and regional bodies. For instance, within the African Union, we're supporting the Continental Framework for NTDs and the Africa Common Position for NTDs. So this is very important. We're hoping that this would be also endorsed by heads of states.
Just moving on from that, how might the UTC support the multi-sectoral approach and focus of the new NTD roadmap, given the things that you have said?
Thank you so much, Patricia. I mean, everybody has echoed the importance of multi-sectoral approach. This is an integral part of the WHO roadmap. And again, I think this is an approach in general to development. I mean, I'm very big on this idea of integration of all development programs, not just health. Overall, the health is linked to education, is linked to climate, and to so many other parts.
Yes.
But particularly in that context, I think we can include more things on vector control, on water and sanitation, education, disabilities, all of which were mentioned. And I think that the adding interventions of this multi-sectoral nature would benefit NTDs, but also addressing NTD benefits everything else, right? I mean, there's evidence that there's economic benefits for the country on human capabilities. Now, how do you encourage these types of partnerships? Again, this is a new part of a core part of the UTC strategy is expanding partners that are not very typical, non-traditional stakeholders that we've seen. One example I give you is last year was the first, we looked at the World NTD Day, and it's coming up on 30th of January this year. One thing, I mean, we as Crime Print Course actually are a big champion of this, but the global campaign will try to demonstrate that NTDs are actually looking at intersection of 11 SDGs out of the 17. So it's very important to expand that sort of partnership and to get more uniting voices to it. But I think not also sectorally, but also voices. And so you see that UTC is also trying to bring in that young voice and engage different types of stakeholders. So you've seen the young networks that we've looked at. So I think, if anything, COVID has shown us that health intersects with every other aspect of our day-to-day. And NTDs, if anything, will just, by integrating this bigger partnership, will help have a bigger capacity for national plans. And I think going forward would be instrumental for the NTD roadmap.
Okay. Turning to you, Greg, for a picture of how pharma and the IFPMA can further mobilize its partners to support milestones and targets of the new roadmap. Greg?
Thank you. Well, first of all, I'd also like to congratulate Dr. Moeli and her team and the WHO for the roadmap, and to give out the message that this industry is fully supportive and behind the roadmap. And we will continue with the commitments and the engagement that we have made, not only after the last 10 years since the London Declaration, but before. And that is indeed mobilizing the numerous number of companies that we have around partnerships from R&D through manufacturing, registration to the supply chain and distribution. So we're highly committed to that. We very much welcome the roadmap, especially the change in focus around a greater country ownership. We find that very important, and indeed domestic resources and resourcing. And was very happy to hear what Minister Dr. Ozagi was saying from Nigeria. It's important that we can combine together and have that domestic resources. Now, from our side, we are engaged in a large number of partnerships, many of them in the R&D area, with, for example, PDPs. Now, the industry sort of operates in three areas, and this is how you can see our mobilization of working. So on the one part of it is boosting R&D and looking into new treatments. A second part is working with partners to strengthening health systems and awareness. And the third is in scaling up existing treatments, including donations. So we would like to be involved in all aspects of the roadmap, which reflect to those three areas.
Thank you, Greg. Dr. Kisito, I'm going to turn to you now. The NNN partnership has contributed to developing new products to align and amplify some key objectives, such as the disease management and disability inclusion. There's the best practice, the WASH toolkit. How do you see this support going forward as the roadmap begins to roll out and, of course, to achieve the 2030 roadmap targets, Kisito? Let's get your mic on there. You're on mute. Dr. Kisito. There you are. I can hear you now.
Thank you. So thank you, Patricia, and thank you very much, WHO, for inviting me. It's been a pleasure. This example example of result and multi-stakeholder cross-sector collaboration, seeking practical opportunity to demonstrate ways to one, integrate NTD initiative where feasible. Two, drive quality, scalable, and sustainability. And three, address the concept of universal healthcare and leave no one behind. These are key tenets of the new roadmap, and our contributions have broken new ground in forging effective working relationships between WASH and NTD programs, considering the respectful engagement of people affected by NTD, and profiling issue of stigma and mental well-being, identifying common framework for sustainability, resource guides for conflict and humanitarian emergency, and appropriately capturing NTD story in the feed and ensuring we don't forget our commitment to community safety and the pursuit of our goal. In the coming 10 years, we will seek to remain, of course, at the forefront of effort to bring passionate people with diverse expertise together to work on shared concerns. Our working group have been an active contributor to WHO consultation about the roadmap and its companion document. And they are developing priority for action in the coming implementation period. We know partnerships are never easy. A familiar African proverb says, if you want to go fast, go alone. If you want to go far, go together. We are thrilled for our support behind the WHO roadmap and proud to contribute to its ambitious goal and work in partnership with endemic country, WHO, and other partners to tackle any unexpected challenges, including, of course, COVID. And we thank WHO for including us on this conversation, and we look forward to working together on the road ahead. Thank you.
Thank you. Thank you. Thank you, Kisito. It's all about partnerships and increasing commitments to overcoming NTDs next decade. How do you plan to adapt your efforts to align with the integrated measures highlighted in the new roadmap, Sylvia? And is your support receiving enough commitment, by the way, by countries to tackle skin NTDs?
Thank you, Patricia, and thank you, WHO, for the invitation. Good afternoon. Well, ANSBAT Foundation works to control, eliminate, and eradicate neglected tropical diseases in sub-Saharan Africa. And in fact, we work there since 2002, and specifically since 2018, there have been carried out several interventions to fight against skin NTDs, especially those of intensive case management, such as Buruli ulcer, leprosy, filariasis, and angiosis. The focus of the intervention is the integrated approach in skin NTDs, one of the orientations of the new roadmap. Specifically, we will put our efforts mainly, and among others, in integrated case detection and management, prevention of disabilities, cross-cutting issues as WASH, as wound care, and SBAT works and will work in partnership with relevant actors and in line with WHO mandate and country health policies. In this sense, we will collaborate with national NTD programs within national health systems in the 4 countries that we support interventions. That is Benin, Cote d'Ivoire, Togo, and Ghana. And SBAT has supported countries and will go on supporting them through their own master plans to fight skin NTDs. Implementing and promoting an integrated and comprehensive approach in collaboration with strategic partners, ANSBAT aims to contribute to make the difference, leaving a long-lasting and suitable impact in the affected people by skin NTDs, communities, targeted countries, and health systems. Thank you.
Thanks there. Priyanka, moving to you, of course, at community level, how these best practices are communicated makes all the difference. So, for example, in India with multiple local languages, tell us about the strategy there and whether it can be adapted to other countries.
Thank you,
Priyanka.
for the opportunity, Patricia and WHO, to speak about the snakebite burden and the model in which Snakebite Healing and Education Society works. This fits actually very nicely with the prevention and control strategy released by WHO in 2019, last year, to bring down the death and disability by 50% by 2030. So I understand about 5 or 6 languages, and this is more or less covers the central part of the country, except for a few states in the south of India and the northeastern parts of the country. And when we have to work in states where we don't understand the local language, we collaborate with local partners who understand the cause and who will share the right information. We have also created short awareness videos, 5 minutes or so on snakebite prevention and first aid. And this is dubbed in 12 languages, which is more or less, it covers the entire country. So we encourage our volunteers to use the educational material made by our organization to ensure that the right message is shared in the communities. I want to share, just yesterday, one of our collaborators from the state of Assam, Dr. Surajit Giri, shared our awareness video in the Assamese language. It was displayed in a musical festival called Krishna Ras Utsav. And these are, through this intervention, he actually was able to reach a minimum of 20,000 people in a span of 3 days. So the strategy is to collaborate. So the strategy is to collaborate with more and more people from across the states who understand the pulse of their regions and how to, disperse the prevention videos and spread awareness within the community.
And just let's talk a little bit there, if you could, about cultural beliefs and how in many places it can interfere with interventions. How do you convince people to seek medical treatment in hospitals, say, for example, in a snakebite situation?
So faith healing is deeply ingrained in the psyche of Indians in the rural communities, especially where maximum incidents occur. In order to bring down, behavioral changes, one has to identify people who are well respected within the community. For example, teachers, village headmen, local quacks. Any message shared through these individuals will be well received. We also use simple logic that people understand. We ask communities, what do they do when somebody has a heart attack? And they say, we rush to the hospital. And what about an accident case? And they say it needs medical intervention in the hospital. So this is when you mention that snake bite is also a medical emergency, just like a heart attack or an accident. So speaking the language people understand is key. And one other important factor is also making children your community educators. So children have a curious mind and a positive attitude, and the prevention part, if well ingrained, they become your ambassadors in their families and also their communities. So transforming the children will bring about behavioral changes in snakebite responses in the years to come.
You're so right, Priyanka. Let's quickly move to some questions and from the audience. Greg, one for you. How can pharma companies get involved in the WHO's World NTD Day activities? Greg?
Well, we'll be delighted to, and I think it's important indeed that the private sector is seen as a partner in these events. And for us, being involved obviously in the roadmap events, but just to emphasize, at the moment, we do have 90 projects with 15 companies, over 14 NTDs ongoing, and being involved with that as well as part of the activities is where we would like to focus our attention on, and looking at areas of new partnerships, which we hope that the roadmap will lead us to.
Okay. Mona, what key partnerships are missing in your context? What other kinds of partners do you need to join your efforts to achieve the 2030 NTD targets?
Thank you, Patricia. I mean, I think we're starting to see more of those types of partnerships. So vector control and WASH are probably very explicit one, but I think we can see more on the education and disability sectors, for instance. I think those are extremely important ones to try and foster. And I personally think that you can also do types of partnerships with private sector that are completely out of your typical health context. So within the World NTD Day, I mean, I'll give you an example. It's how do you broaden the partnerships to things that are more on the advocacy side to raise awareness about NTDs. I mean, we've mentioned this several times, NTDs are diseases of neglected people. So how do you raise awareness in the so-called global north, for the lack of a better term, but through those types of partnerships that you host with consumer good types of private sector, with all sorts of the private sector through different mechanisms. So I think there's partnerships in different ways on the technical and non-technical side, because the advocacy is equally important to the technical interventions.
That's correct. Yeah, thinking out the box, I think. Yes. Sorry, I was so busy listening to you, Mona. I wasn't even looking at the questions. Kisito, here's one for you. What new partnerships do you see that NTDs should make in order to reach the 2030 NTD targets? Kisito, did you hear me?
Yeah.
Yes, if you could respond.
But would you mind repeating the question quickly?
Oh,
would
sure.
you mind repeating the question quickly?
Sure. What new partnerships do you see that NTDs should make in order to reach the 2030 NTD targets?
Yes, I think since 2009, the NTD NGO network has placed a partnership in its core. and serving the forum for NGO partner working together to reach our goal. So I think the NNN provides a platform for disease and cross-cutting experts to target the evidence and knowledge gap, identify issue and share concern, and tackle, of course, the barrier of the heat map. So what we need is to focus into the integration to be able to amplify the work we are doing. One example I should give to making sure that we've got to harness new partnership that are coming is that NNN can enable the new roadmap by providing a platform for cross-sectorial engagement with new sector, build new partnership, as well as develop existing. Most recently, as example, the NN issue a call to action on Global Hand Washing Day with a commitment to hand hygiene for all. So in supporting the implementation of Wash Toolkit, for example, that will give us a better reach, a broader platform to reach new, innovative, and of course challenging ourselves to address all the risks that we will encounter, like COVID, for example, and use that to increase, keep, I would say, the performance at high, optimal as possible, and champion the target, the roadmap target, the 2030 roadmap target.
Okay, thank you, Kisito. A question for you, Priyanka. How has your partnership platform considered the specific needs of marginalized or underserved endemic communities, those in insecure areas where service provision may not be consistent, to ensure that we plan forward and genuinely leave no one behind? Big question there for you, Priyanka, to wrap up the Q&A.
Actually, my internet is unstable and I did not hear the question. Can you repeat it,
Sure,
please?
I will repeat it. How has your partnership platform considered the specific needs of marginalized or underserved endemic communities, those in insecure areas where service provision may not be consistent, to ensure that we plan ahead and genuinely leave no one behind?
Wow, so there are a lot of things that we do. So we started the organization Snakebite Healing in 2014. And through this initiative, we have brought together people from all kinds of skill sets and expertise to create synergies with government and non-government entities, NGOs, academia, media, and the general public, as all have a role to play in snakebite prevention. We have collaborated with missionary hospitals situated in remote locations to procure antivenom at a cheaper rate, than what they were procuring from local pharmacies. We also created community awareness in the villages around these hospitals. Another significant collaboration has been with the state forest departments, and also to use their facilities to do community awareness programs for the communities around their office spaces. We work with medical colleges to facilitate training on junior doctors, and collaborate with antivenom manufacturers to supply antivenom to remote hospitals at a distributor's cost, which helps bring down the cost of treatment for the poor victim. And we work with senior government officials to help with strategic changes that can help the cause. And one last thing I would like to mention is also that we produced India's first advocacy film on snakebite burden. It's called The Dead Don't Talk, and it is available YouTube. And this film was possible only because of the goodwill we have created since the last few years. We were able to film in the government hospitals, interview experts, reach out to families from 14 states to document their stories. So this film has given an opportunity to the victims themselves to share their circumstances and helplessness. And this has become a powerful tool to convince people in important positions of power. So, there's all the synergy with people from very different backgrounds, and we just try to harness everyone's skill to
Yes.
Yeah.
Thank you so much, Priyanka, and thank you once again to everyone who has contributed to today's conversation, and that you found it not only riveting, but that what you've heard inspires you further into creating even more meaningful collaborations. Any Kiswahili speakers here will know the word pamoja, which means together, which is the only way we can achieve the ambitious roadmap targets. For now, stay safe, stay well, and here's wishing you and your loved ones a peaceful, festive season.
ትራኮማ ማለት በአይን በማይታዩ ባክቴሪያዎች ምክንያት የሚመጣ በሽታ ነው። በአብዛኛው የሚያሳያቸው ምልክቶች የአይን መቅላት፣ ማሳሸት፣ finally the patients may become blind. ስለዚህ ህብረተሰቡ የቲቲ ሰርጀሪ አገልግሎት እየሰጠው ይገኛለሁ። መጀመሪያም ወደ ሙያው የገባውበት ጸጉር ከአይናቸው ውስጥ ገብቶ በጣም ይቆረቆራቸው በጣም ያማቸውም ስለነበር እና ከዛ በኋላ ያ ፔን ሲቀንስ የሚያሳዩት ነገር በጣም ነው ደስ ግን አንድ በጥሩ ገጠመኝ ምንድነው አይኗን ከሰራውላት በኋላ ሰትየዋ እንደ ምድን አልጠበቀችምና ጸጉሩ በጣም ፔን ስላለው ያ ፔን ተወግዶልኝ ወይም ደግሞ ያለ ህመም እኖራለሁ ብላ አላሰበችምና ያቺ ፔሸንት ግን ሁሉ ነገር ደህና ሆና በወሩ ለፎሎ አፕ ስቀጥራት ማር እና የሸት በቆሎ ይዛ መጣ። ግን እሷ ከኋላዬ ነው አርጋ ሄደችውና በበነገታው ነው እኔ ራሱ ያየሁት ያ ማምጣቷ ሸጉጣው ሄደችውን አረሳም። እንዴት ሰርጅን ማለት ፈልገው ለቲ ሰርጅን ከምንም በላይ እንዳው ነበረሰ ማይገድ በላይ ደስታ የለም። እጅግ በላይ የሚያስደስት ደስታ የለም።